Hi there, I'm Leanne Sherrod, a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Today we're discussing tongue ties, including what parents and caregivers should know about their potential effect on their child's speech. First, let's define the term tongue tie, which is also known as ankyloglossia. A tongue tie refers to having a short or tight lingual frenulum. This is the band of tissue under the tongue that connects the tongue to the floor of the mouth. A short or tight frenulum can limit or restrict the movement of the tongue. The exact cause of a tongue tie is unknown. However, we do know tongue ties are 3 times more common in males than females. They've been noted to run in families, and they're associated with certain genetic disorders. So, how do you know if your child has a tongue tie? Some signs and symptoms can include a tongue that looks notched or heart-shaped when your child sticks it out, difficulty lifting the tongue to the upper teeth, trouble moving the tongue side to side, or difficulty sticking the tongue out past the lower front teeth. You may be wondering if a tongue tie can cause problems. A child with a tongue tie may have problems with breastfeeding, speech, oral hygiene, and even social concerns. Let me elaborate on this a little more. During breastfeeding, a tongue tie may cause a baby to chew rather than suck. Some babies may also have a poor latch. These issues can lead to poor nutrition and failure to thrive. A tongue tie can also make it hard for a child to clear food from their teeth and inside their cheeks, leading to tooth decay and gingivitis. And socially, sometimes a child may feel embarrassed about their difficulty with certain everyday tasks, like licking an ice cream cone. Okay, so what about speech? It's true that a tongue tie can interfere with a child's ability to make certain sounds, although this isn't always the case. The overall consensus in the research is that a tongue tie does not necessarily lead to a speech delay or disorder. There simply isn't enough evidence to say that tongue ties affect speech production or speech clarity. If your child has a tongue tie, their lingual frenulum can loosen itself over time. In other cases, a tongue tie can persist, but without causing any problems. However, if a tongue tie is causing concern, there are a few treatment options, including surgery to release the lingual frenulum. If you have concerns about a tongue tie, it's best to have your child evaluated by their pediatrician, a pediatric dentist, and a speech therapist. This team of professionals can help make a decision specific to your little one's needs. If your child has speech problems, the speech therapist will assess if their speech production can improve by therapy alone without surgery. It's important to know that tongue tie surgery is not recommended in order to prevent speech problems. Basically, we would never recommend releasing a tongue tie to stop a child from potentially having speech issues. Think about the overall impact of the tongue tie on your child's life as you consider the next steps. If you have concerns, talk with a speech therapist. They're a critical part of your child's care team and can help guide you along the way.